Okay, I'm knocking on the door for lighting privacy. I'm washing my hands. Hello, my name is Nirvana. I'm here with Presentation College. I'm a nursing student and I'm here to do your head-to-toe assessment. How are you feeling today?
I'm good.
Okay. Can you verify your name and date of birth?
My name is Devon Ramdiel. I was born April 20th, 2003.
Okay. And do you have any allergies?
No, not that I know.
Okay. Alright. So today's assessment, I'm going to be assessing from your head to your toe. I'm looking for any abnormalities, any bruising, laceration, any bulging. I'm going to be checking your muscle tone, your strength, your skin trigger, skin temperature. If there's any pain throughout this assessment or tenderness, can you please let me know? Okay. We're going to start with the eye exam. Go ahead and cover one eye. I'm going to hold this 14 inches away from your eye. And please read the smallest line that you see.
4, 2, 8, 7, 3, 9.
Okay, the other.
4, 2, 8, 7, 3, 10.
Okay. Patient has 20 to 20. Eye vision bilaterally. And now I'm going to go ahead and start with your head. Alright. So I'm just looking around. The patient has nice thick black hair, no balding noted, no patches. The patient appears to have good hygiene. He's dressed appropriately for the exam. He's alert and orientated times 4. Mood is pleasant. He doesn't appear to be having any problems with hearing or speech. He's answering my questions appropriately. There's no flaking or dryness in the scalp. The hair is not dry or brittle. I'm going to go ahead and feel the scalp. There's no bulging or depressions noted. Is there any pain or tenderness?
No.
Okay. Alright, I'll have you go ahead and turn this up. I'm going to go ahead and feel the temporal artery. Any pain or tenderness?
No.
Okay. The temporal artery is elastic and non-tender, which is normal findings. I'm going to feel your palpate your temporal mandibular joints. Can you open and close? Open, close. Can you go side to side? Okay, there's no popping or clicking noted. Okay. I'm palpating your ears. Is there any pain or tenderness there? No. Okay, good. Alright. Okay, I'm going to check your corneal light reflex. I'm putting the light on the bridge of the nose. The light is seen equal and bilaterally in both pupils. Both have brisk constriction. Pupils are equal and reactive to light and accommodation. The eyebrows is nice and thick. The eyelashes are evenly spaced. The skin is warm and dry. There's no cracking, no lesions, no flaking. The conjunctiva is pink and moist. The sclera is white and glossy. The iris is brown and colored throughout. The upper conjunctiva is nice and pink. Alright. Go ahead and hold this over one of your eyes. And tell me when you can see my fingers in your visual field. Okay, other eye?
Yeah.
Okay. And now, watching the pen light, I want you to watch it follow with your eyes, not with your head, okay? No nice thickness noted, that's perfect. I'm going to go ahead and check your
your leg.
Okay. Now go ahead and look at your ears. Pulling the pin up and back. There's no discharge, no foreign objects. There's a small amount of serum present. Tympanic membrane is normal. There's no foreign objects. It is pearly gray, translucent. I'm going to go ahead and palpate your sinuses, your frontal sinuses, your maxillary sinuses. Is there any pain or tenderness? Okay. How about when I press on your nose? Okay, nose is midline. Can you plug one ear and sniff? And the other side? Okay. Both nostrils are patent. There's deep pink mucosa. At each, there's no foreign objects present. The septum is midline. Turbinates are visible. There's no deviation. Everything is midline and appears normal. I'm sorry. Can you close your eyes? I'm going to check the cranial nerve 1. Can you tell me what you're smelling? Okay. Cranial nerve 1 is intact. My patient telling me what she smells. Can you open up and say ah? The uvula is midline and protrudes upwards. Tonsils are visible. +1. Teeth are evenly spaced. There's one carie on the lower molar on the left. The tongue has white coating, which is normal. The gums are pink. There's no bruising or any laceration noted. Gums look good. He has nice white teeth. Okay. I'm going to check your facial symmetry. Can you smile for me? Can you puff out your cheek? Can you raise your eyebrows? Squint your eyes? All right. I'm going to go ahead and palpate your carotid artery. Okay. Now go ahead and listen for any buoys. Can you hold your breath? Okay, and this side. No buoys are present. I'm going to go ahead and palpate your trachea, which is midline and symmetrical. I'm going to palpate for the thyroid glands. I'm going to move the trachea over. Swallow. Okay. The thyroid gland is not palpable, which is normal findings, and that indicates absence of any inflammation or infections. Can you tip your head back? I'm going to check your jugular vein. I note pulsations, but no distension in the jugular vein. And the same on this side, no distension, just mild palpation visible. Let's go ahead and do the hearing test. I'll hit the tuning fork and I'll place it on top of your head. And let me know if you can hear it in both ears, okay? Let me know when it stops, okay? Is it both? Stop. Okay, and now on each ear, I'm going to hit the tuning fork again, and let me know when you can no longer hear the vibration, okay? Okay, we'll go ahead and check the other side. Okay, the bone conduction was 9 seconds and 22 for ear conduction. I'll do this side again. Okay. Alright, so bone conduction was 8 seconds and 21 seconds for air conduction. We're going to check now your lymph nodes. We have the occipital lymph nodes, post-articular lymph nodes, the preoccipital lymph nodes, the thyroid lymph nodes, the retropharyngeal lymph nodes, the submandibular lymph nodes, the submantle lymph nodes, the posterior cervical lymph nodes, the anterior cervical lymph nodes, and pneumodus. And this is the supraclavicular lymph nodes. I'm unable to palpate any of the lymph nodes, which is in normal findings, and that indicates that absence of infection or any inflammation. I'll go ahead and do a whisper test. Can you close one ear? And I'll say 3 words, and if you can just repeat after me, okay? Alright.
Dog, cat,
Okay. Here, here.
sleep,
Yes. Try that again this time.
baby, bottle, pacifier.
Okay, perfect. We just finished the Weber, the ring, and the whisper test for the hearing. Can we have you turn around? And I'll check your sinus process, which is midline and symmetrical. I'm feeling for any bumps or any bulges. Can you take a deep breath in? Okay. Another one in and out. Thoracic expansion is equal bilaterally. Everything appears symmetrical. I'm going to go ahead and press. Any pain or tenderness? I'm going to check down here for CVA. Any pain or tenderness there? Okay, and with no tenderness, that's indicating that there is no infection around the kidneys or abscess. Alright. Okay, take some deep breaths in and out. Lungs sound very clear bilaterally. Can you say the words 99?
99.
I'm checking for tactile vitals. Okay.
99.
Okay, perfect. Can you turn towards me? Can you say 99?
99.
Perfect. I'm going to go ahead and inspect the skin. All of the skin looks unchecked. There is no bumps or bruises. Temperature is warm and dry. There's no laceration. No bulging, bruises. The chest is symmetrical. It rises and falls with each breath appropriately. And I'm going to go ahead and percuss. Okay, I'll go ahead and listen. Go ahead and breathe. Perfect. Lung sounds are clear throughout every lobe, bilaterally. I'm going to feel this in the line. Go ahead and listen to your apical pulse for 30 seconds. Can you lift your shirt up? Okay. So it's 40, so that's 80 beats per minute. Normal breathing rhythm. Actually, I'll go ahead and listen to the 5-part sound of the diaphragm. The aortic. The pulmonary. The larynx point. Tricuspid. And the mitral valve. And I'll go ahead and listen again to the 5 with the bell. Aortic. Pulmonary. Larynx point. Tricuspid. And the mitral valve. Okay. There is normal breathing rhythm for S1 and B. There was no S3 or F4 noted. Everything was regular. Okay, let's go ahead and do some range of motion. Can you pull your arms up? Pull your arms up. Okay, down. Shrug your shoulders. Okay, chin to the side. Chin to the chest. Head all the way up, back. Side to side. Okay. Go ahead and push against the resistance of my hand under my neck. Okay. And then forward. Okay. And then side. Okay. And the other side. Okay. Push up against on your shoulder. Okay. And can you put your arms out? Put that down. Go back. Forward. Perfect. I'm checking the trapezius and sternum side muscles. Muscle tone, which was strong. I'll check your brachial pulse. Brachial pulse is strong bilaterally. I'll check the radial. Very strong bilaterally. Can you put your hand? I'm going to feel behind your knee for your popliteal pulse. And the tibia. And the tail pulses. Alright. All pulses were strong bilaterally. So let's check your reflexes. We're going to do your bicep, tricep, and your brachial radialis. Okay. That's bicep, tricep, and brachial radialis. All right. Okay. I think everything looks good. Let's check the patellar reflex. You just put your right hand. Put it down. And then check in the Achilles by your ankle. Okay. All right. Go back. Okay. So we'll check your arms. Can you do this? This. Rotate your wrist. The wrist alone. The wrist alone. Okay. Push up on my arm. Okay. Push down. Okay. Go like this. Alright. Put your thumb to your fingers and do it fast. Okay. And push down. Next, I'm going to check your abdomen. Let's check your abdomen. First, I'm going to inspect. The skin looks good. It's just slightly a lighter color than the leg and the arms. Everything appears symmetrical, midline, the umbilicus is midline. There's no bulging noted. I'm going to go ahead and listen to the aortic for any buoys, and then I'll go ahead and listen to all 4 quadrant for vowel sounds. No buoys present, so I'm going to listen to the vowel sounds. Patient has active vowel sounds in all 4 quadrants. I'll go ahead and percuss. Perfect. And now I'm just going to palpate very lightly, okay? I'm feeling for any pain or tenderness. Checking for any enlarged organs. I'm going to go a little bit deeper, okay? Tell me if you feel any discomfort or anything. Perfect. I'm going to feel for your femoral pulse. Femoral pulse is strong bilaterally. I'm palpating for the angular lymph pulse. And they're unable to be palpated, which means that there is absence of any inflammation or infection. I'm going to instruct the patient on doing testicular exams. Just remember that every month you do it at the same time, preferably when you get out of the shower, and you would just take your fingers and massage your testicles, and you will try to feel if there's any bulging or if there's any pain when you're touching it. If this was a woman patient, I would instruct her how to do a self-breast exam, and usually you'd want to feel around the breast tissue for any bumps or tenderness. If there was any discharge in the breast, that would have to be told to the physician. I would also tell the patient to massage underneath the arm here for any swollen lymph nodes. And also with a male patient, if there's any drainage out of the penis, needs to be noted to the doctor. All right, can you take your knee to your chest? Okay, back out. Go straight up with it. Back out. The other side. Okay, out. And straight up. Okay, and can you take this and bring it up? Okay, and then the other side. Okay, and then down. Thank you. And she has flexion. He has flexion and extension. Push down. Okay, and push up. Okay. And can you take the heel of your leg and rub it against it? Okay, and then the other side. Okay. All right, you can go ahead and stand up. And you can come back over here. Can you lift up a little? Okay. All right, and go ahead and try to push up. Okay. And try to push down. Okay. And push up. Okay. And push down. Okay. Can you turn your ankles out, inward, wiggle your toes? Okay, move your feet around. Okay. And go ahead and push up again. Okay. There's no bumps, bruises, or laceration. Triggers are all normal. Let's see. We're going to go ahead and check the sensations. Okay, close your eyes. Let me know what you feel, okay? And where you feel. Close your eyes. And if you feel a vibration too, let me know, okay? And let me know if it's something registered. Okay?
Hard, sharp, left arm.
Okay?
Sharp, right leg. Sharp left leg. Sharp upper thigh. Sharp right upper thigh. Sharp right foot. Sharp left foot. Sharp left arm. Sharp left right arm. Soft left arm. Soft right arm. Soft left foot. Soft left leg. Soft left foot. Soft left foot.
Okay.
Vibration, hard vibration, right, left leg. Hard vibration, right, upper thigh. Hard vibration, right.
Okay. The patient was able to feel sensation between the upper and lower extremities, between soft, sharp, and vibration. Close your eye. Okay.
Yeah. Hard vibration on both shoulders.
Okay. And then the left.
Hard vibration on left foot.
Okay, I'm going to put something in your hand. And just let me know what it is. Okay. And this.
Rubber band.
Okay. I'm going to draw something in your hand. Let me know what it is.
3.
Yes.
X.
Yes. And put your hand up. Can you feel it?
Yeah.
Okay. All right. So we'll go ahead and stand up. Bend over. Touch your toes. So I'm looking at the spine here, in the range of motion. There's no scoliosis, kyphosis, or lordosis present. Spine is perfect and in line. Okay, you can go ahead and stand up. Can you turn side to side? Okay, lean backwards and forward. Flexion and extension, everything is intact. Can put your hands up, down. All right. Close your eyes and stand up. The Romberg test is negative. Patient is not swaying. Do you feel dizziness? Okay, so no dizziness or swaying notice. So that test is negative. All right, and I'll have you stand here. And can you please walk normally towards the couch? Okay, and now walk heel to toe back. All right, and then going that way, walk with your heel. Okay, and then walk with your toes coming back. Okay, all right, you can go ahead and sit down. And I think everything is good. That's the completion of our head to toe assessment. Thank you very much for cooperating with me. And patient had a steady gait. There was no abnormalities noted. Do you have any questions for me?
Thank you for checking.
Okay, you're welcome. Everything looks good. Thank you.